We're talking today about sleep apnea and other sleep disorders. With us again is Lisa Firestein with Active Healthcare of the Triangle. Lisa, thank you again for being with us. Now, before the break, we were talking about sleep apnea, some of the signs and symptoms, and some of the treatment options. What happens when or if sleep apnea goes undiagnosed?
Well, what happens when one has sleep apnea is that the pauses in breathing at night lowers your blood oxygen level, which puts a real strain on your heart. So there's quite a number of cardiovascular problems, heart problems that occur. So folks that have untreated sleep apnea are at 5 times more risk of a fatal heart attack. They're at 2 times more risk for a stroke. They're actually 2 to 3 times at a higher risk of dying. And they're at 6 times more risk of a very serious vehicle accident. And also, there's new research coming out almost weekly on the effects of sleep apnea and the health. And diabetics, there's a real association between diabetics and folks that have sleep apnea. And they feel that up to 50% of diabetics have sleep apnea. And in North Carolina, that's a real problem. We are one of the highest states with diabetes, and we have 1 in 10 diabetics in North Carolina. 1 in 10 folks have diabetes in North Carolina.
That's a huge number.
And that is huge, and it's actually doubled over the last 10 years, our amount of diabetics in North Carolina. So it's a concern.
So all of these health factors, all these health concerns make it even more important to get screened, particularly if you suspect that you may have sleep apnea or some other sleep disorder.
Absolutely. And aside from the very bad health effects, is productivity of work is decreased, and just your reduced quality of life. So yes.
I understand Active Healthcare is offering free screenings. You've had 2 already, and you have some coming up. Tell us about those.
Well, we're real excited about the response that we have gotten from the folks in the Triangle. It's been interesting to see the amount of people that have come out for risk assessments of their sleep apnea, that they're so happy to have a place to have this. And so what somebody can expect when they come to nurses and respiratory therapists will be on hand to give the risk assessment, to screen for sleep apnea, and then we are available to discuss the signs and symptoms and what happens if you go without getting it treated. For those folks that currently use CPAP, we are able to check their machines and look for mask leaks.
Okay, what does CPAP stand for?
CPAP stands for Continuous Positive Airway Pressure.
Okay, and that's what we have here.
And that's what we have here. And so it's a great opportunity for folks to come and learn about sleep apnea.
Okay, we will make sure that we give people the times and dates so they can mark their calendars for that. You have one coming up March 24th in Clayton, and we have that address that will be available. But these health screenings are from 5 to 7 p.m., so they can go out. And also on March 31st, that one will be in Durham on Tower Boulevard, and people can register in advance for these free screenings, and they can do that by going to sleep@activehealthcare.com, or they can always call 919-870-86 extension 200, and of course they can register that way. If they want to just find out more information about Active Health Care, then they can certainly go to your website, activehealthcare.com, and there's a wealth of information there to let them know all that there is to know, or all that they might need to know to take that first step in finding out about sleep apnea.
Absolutely.
Okay. Again, when you talk about the screening process, how long does that take for someone who may be interested in going to one of these screenings?
The screening process is about 5 minutes, and then we have them talk with a sleep specialist consultant. And so that can go anywhere from 5 to 10 minutes, really depending on the length of questions that they have. We want to be available for all the people that we're getting. And so we can certainly talk for hours with somebody about sleep apnea, but in the interest of trying to see as many folks that want to come in, we've been trying to limit it to about 5 to 10 minutes per individual.
I understand that you also spend quite a bit of time with some of your patients talking about sleep hygiene. Tell us what that means.
Well, sleep hygiene is a term that's used to help people get a better night's sleep. And so some of the things that will help in thinking about sleep is, number one, you want to make your room, your bedroom, conducive for sleep. So you want it to be quiet, dark, and cool. Another thing you would want to do is go to bed at the same time or near the same time every night, and even on the weekends, and get up at the same time. So that helps set your circadian rhythm. You want to think about only using your bedroom for sleep and some other things, but keep the television out of the bedroom, keep the computer, keep doing work out of the bedroom, put that elsewhere. So you're thinking psychologically that I'm just going to sleep and that's what I do here. And also you want to prepare yourself for sleep before by getting in a relaxed mode, maybe drinking some hot tea, hot milk, taking a relaxing hot bath. Some other things that you can do that you don't want to do right before you go to sleep is eat a heavy meal. It's very hard to sleep, go into deep sleep after if you've eaten a very heavy meal within 2 to 3 hours of sleep. Also, exercise. You don't want to exercise 2 to 3 hours before you go to sleep. And you really is best if you can avoid caffeine, nicotine, and alcohol close to bedtime. So those are some of the tips that we give that we call sleep hygiene to help one sleep.
How do you know when you've had a sufficient amount of sleep? Because some people, like I can function fine, I think, off about 5 hours, where I have friends who say if they don't get 8 hours, they can't think straight. So how do you know when you've had enough?
Well, the typical amount of sleep that we like to see is between 7 to 8 hours of sleep a night. Okay. But there are some folks, as you've mentioned yourself, that can get by on 5 hours of sleep. But it's really amazing when they do get that full nights of sleep, how much different they feel the next day. And so the research really does show 7 to 8 hours of sleep is the best.
Does that vary according to age? Do our young people need more sleep, less sleep? Can you talk a little bit about that?
Our youngest members, our babies, need lots of sleep hours, and that's really to help their brain grow. And so they're going to need the largest hours, and then as one goes into toddlerhood, it goes down from 10 to 12 hours to more in the 10-hour range. And it really stays that way for our teenagers. However, our teenagers really don't get the amount of sleep they need, and probably are very sleep deprived, and especially with our high schoolers, who many have to start school at 7:30 a.m. and that get on buses in the dark between 6 and 6:30. And interestingly enough, there are some states in some districts that have actually had a law where they have changed the time of the high school start time to a later time to accommodate for more sleep.
Right, I know that's been a debate here in North Carolina. It will probably continue for years to come on that start time for high schoolers, but there is, as you're saying, scientific research that shows that those teenagers do need that additional sleep.
And even thinking about our teenagers and studying, and there's quite a bit of research out there when a teenager or an adult studies for a test, they will do better on that test if they have a full night's sleep versus pulling an all-nighter. The amount of memory and information they retain is less when they pull an all-nighter.
Lots of good reasons to get that rest and just cut the light off, stop the studying, and go to bed.
Yes.
Okay, we're going to take a break. We'll talk more in just a minute.
Okay.
Don't go away. Tarheel Talk will continue after these messages.